Welcome. With the pressure ball, you're going to look into using a chair, using your bed, and finding the proper position to press against these areas of your buttocks in order to release, hold, and use a chair to sit on or use your chair to use against your back and work away the pressures, the pressure release, the acupressure. If I'm taking out the muscles to show you here to illustrate how every muscle is really intended to pull either that hip bone backwards, rotate it forward, and rotate it in and out. For the runner, for the person that we want to consider for the front area, we want to release the iliopsoas, the hip flexors that are going to be identified here in these dots. And this is really important to work the ball into these areas to get it nice and loose. So then when you stretch and when you start to activate before, you can have an excellent outcome. And we can have micro mobility and better muscle stability with these inner muscles that are being isolated, and you can identify that there is a growing pelvic relationship to the leg. And these are the two big muscle areas to consider in the lower portion of the body. Momentarily, we're going to go up to the shoulder complex, where we're going to identify the two powerhouses, the movers for the front shoulder, which are the deltoid anterior and the pectoralis. And then we're going to identify the back, the typical client that works at the office, that hunches over, the shoulders are rolling forward and the head's a little bit slightly forward. We want to definitely work these back muscles of the trapezius, the deltoid, the rhomboids. And I'm going to identify certain points that also need to be pressed using the acupressure ball, and that you need to release to have good hygiene of the pectoral and the back relationship of yourself aging into putting that head in pure center and not letting yourself get this damage because of uneven weight, unaligned burden of weight. Just like a car not having alignment, you will wear and tear in ways that were not meant to just because of posture, and then you're going to get in trouble and talk to a surgeon about it, where you can prevent it today with this proactive approach. So this is me taking out the muscles that are stabilizing your scapula to your back to demonstrate the importance of that ball to really get deep in it and get deep into the next points that I'm going to show you, which are in the anterior shoulder complex. We want to release the insertion points of the pectorals, and we want to also work this for the person that's active, for the gym goer, the person that plays tennis. And so invest in your future, invest in your body. It's the only one we got, the tempo. And I wish you an excellent day.